Hi, my name is Yuriy Kolesnichenko. I'm the Sonologist from Moscow, Russia. This lecture, Acute Scrotum and the Practice of Pediatric Sonography. Acute scrotal syndrome in boys is a complex of disease manifested by acute symptom and scrotum area, pain, enlargement, redness. Differential diagnosis of acute scrotum may include hydrocele or epididymitis, torsion of the testicular appendage, Morgagn testicular torsion, strangulated scrotal hernia, scrotal fat necrosis, trauma, idiopathic edema of the scrotum, connection and purpura, testicular infarction, background and thrombosis, else. As with suspicion of many other acute conditions, ultrasound acts as primary diagnostic method in the acute scrotum, and the main acute diagnosis requiring exclusion in the practice of pediatric ultrasound are torsion of the testicular epididymal appendages, Morgagn testicular torsion, or epididymitis or heat cell epididymitis, strangulated hernia. Some quotes from Russian textbook edited by Pikov, Ultrasound Diagnostics. In early childhood, it has a structure and a homogeneity equal to testicular tissue. At an older age, it transforms into a vesicle with an anechoic lumen and thin capsule. Acute lesion of hydatids arise as a result of their torsion. Ultrasound conclusion is established on the basis of pathognomonic sign, which consists of absence of blood flow in the appendage, which is normally well blood supplied. Clinical diagnosis of hydatid disease is difficult, and usually torsion passes under the mask of epididymitis or epididymitis. Another quote from textbook of Sigel, Pediatric Sonography. Torsion of testicular appendages. Clinically, the condition can mimic acute testicular torsion. Clinical differentiation is important because torsion of appendix is not a true surgical emergency, whereas immediate surgical intervention is required for testicular torsion. Atrophy of the appendage and resolution of symptoms with supportive care is usual outcome. Presently symptomatic appendages may require surgical removal. Infarcted appendages eventually shrink in size, may calcify and may break free to become scrollets. Some examples of normal echo pattern of appendages. We can see here cystic echo pattern with pedicle, solid echo pattern, another two solid echo patterns. Pathology examples of torsion of testicular appendages, cystic echo pattern, complex cystic echo pattern like cyst with thickened wall, solid echo pattern, another solid echo pattern. An echo picture of hydatid torsion with a cystic echo pattern is often undistinguishable from an echo picture of epididymitis with epididymis cyst. Moreover, some authors consider the cystic form of the epididymal hydatid cyst of the epididymis on a pedicle. As in case of testicular torsion, which we will talk about a little later, there is also can be an incomplete or partial torsion of the hydatids, or torsion-detorsion syndrome, which can lead to false negative diagnosis from a series like your diagnosis was not confirmed. Testicular torsion is an urological emergency and must be distinguished from other causes of acute scrotum because its delay in diagnosis and management can lead to testicular loss or infertility. Torsion can be congenital or accurate and can occur at any age, but usually affect 1 in 4,000 men under 25 each year. Diagnosis of partial testicular torsion with torsion-detorsion syndrome is challenging because changes in the testicle depends on the duration and degree of torsion symptomatic cord. Torsion-detorsion syndrome or intermittent testicular torsion syndrome is defined as acute periodic testicular pain due to obstructed blood flow, alternating and painless intervals. At ultrasound, similar pattern in B and Doppler modes are often observed in epididymitis and partial testicular torsion with torsion-detorsion syndrome. Also, testicular or paratesticular hyperemia during the torsion-detorsion syndrome. Detorsion phase can be confused with epididymitis. The clinical presentation of testicular torsion and acute epididymitis is also often similar. The diagnosis of intermittent testicular torsion syndrome is important because these patients have a high risk of developing acute torsion. Misdiagnosis or delay in diagnosis can lead to acute stable torsion and potential loss of the testicle. According to a textbook of normal anatomy edited by Sapin, the testicle and epididymis are supplied with blood flow from testicular artery, branch of abdominal aorta, and partly from differential artery or artery of vas deferens, a branch of the internal iliac artery, which anastomoses with testicular artery. However, it is only epididymis, but not testicle, has double blood supply from these two arteries, which are stomos, and despite the fact that they both pass in the spermatic cord and can twist, it's only in the epididymis, due to its double blood supply, blood flow can be visualized on ultrasound in the case of torsion. I'm writing all this here because one day I heard a surgeon comment that if there is a blood flow in the epididymis, then there is no testicular torsion, which is wrong. Ultrasound criteria for testicular torsion: B motor, grayscale criteria, the testicle of normal echogenicity, the initial stage. After 4-6 hours it becomes gypoechoic, after 24 hours it becomes getoechoic, picarosis. Thickening of the scrotum wall, thickening twisted spermatic cord, hydrocele, Doppler criteria, classically with complete torsion without blood flow in the testicle, and increased blood flow around the testicle as the CFM color flow mode. Partial and complete intermittent torsion with torsion-detorsion syndrome. The testicle periodically twists and twists, so blood flow can be any variant at CFM, absent, normal, decreased or increased, at hyperemia after spontaneous detorsion. In pulse wave it may not be registered arterial spectrum. Example of testicular torsion echograms. We can see a sign of ring of fire, then no blood flow inside testicle, only around. Another echogram of necrosis of torsion testicular, another testicular torsion with necrosis, another testicular torsion with necrosis inside the inguinal canal. Then the testicle twisted, ultrasound can visualize the torsion of the spermatic cord, which on color flow mode looks like a Whirlpool sign, or as sometimes I call it a vortex sign, or sometimes it's called a cochlear sign, yin yang sign, Pepsi sign, or else. According to a session, a mean torsion angle of 540 degrees was noted in 70 cases of orchectomy, and a mean torsion angle of 360 degrees was observed in 116 cases of surviving testicles. We can see another examples of Whirlpool, cochlear sign, or a Pepsi sign, or else another Pepsi sign, another twisted magistral vessel we can see in case of torsion of spermatic cord. In other examples, echograms. This is orthoepididymitis examples. We can see enlarged epididymis with increased blood flow. It's CFM. We can see enlarged epididymis with increased blood flow in epididymis and testicle. We can see heterogeneous content around the testicle, and this is pyocele. We can see heterogeneous testicular structure in orthoepididymitis. As in many other cases, ultrasound is only an initial method of visual diagnosis of the groin and scrotum, and computed tomography, magnetic resonance imaging can be recommended, prescribed to verify the diagnosis. But in practice, this happens extremely rare. Some case from my practice. This is example of torsion of Morgagn hydatid or testicular appendages with secondary pyocele. A middle school child with testicular pain that arose the day before. It was taken to the Children's City Hospital via the ambulance. Ultrasound, we found an increase in size epididymis with increased blood flow at CFM, and testicular appendage with cystic echo pattern. We can see it here. And paracel near. You can see a fluid with septum. Another example of torsion of Morgagn hydatid, 1-year-old child with suspicion of hydatid torsion. We can see a paracel. We can see and we can see a complex cyst appearance of hydatid. Another example of torsion of hydatid Morgagn, a teenager, and we can see at ultrasound enlarged epididymis and solid echo pattern of hydatid Morgagn or testicular appendages, and secondary epididymitis. Another echo pattern, big lesion near the testicle and the epididymis, which is torsion of hydatid Morgagn without blood flow at color flow mode. Another example of torsion-detorsion syndrome of hydatid, of testicular appendage. This case is interested because of misdiagnosis. Initially, it was diagnosis as epididymitis, but at the second look ultrasound, I found enlarged appendage with blood flow at color flow mode. It's detorsion phase of torsion-detorsion syndrome of the appendage testicular. Another example, this is a partial testicular torsion. We can see increased blood flow around the testicle, some kind of ring of fire around, and no blood flow inside of testicle. Another example, this is example of neonatal or congenital or extravaginal testicular torsion. We can see necrotic testicles with chicken egg appearance or target sign appearance without blood flow at color flow mode. Another congenital testicular torsion with target sign without blood flow inside. Another testicular torsion in the inguinal canal. We can see testicle without blood flow inside. Another example where we can see the torsion of spermatic cord, Pepsi sign. Another example of incomplete testicular torsion. We can see vortex sign or whirlpool sign, twist of spermatic cord. Pepsi sign. Another example of testicular torsion or torsion-detorsion syndrome, we can see the testicle, which is abnormally located. Posterior to the testicle, we can see the loops of spermatic cords and some kind of abnormal vessels, magistral. And this is the example of epididymitis and an infant with enlarged epididymis and increased blood flow at cauliflower mouth. And another example of orthoepididymitis with mostly enlarged and heterogeneous epididymis with increased blood flow in the epididymis and testicle. Another example of orthoepididymitis with heterogeneous enlarged epididymis with cystic structure inside, which can be an appendage, which can be a torsion of the appendage. We can see also increased blood flow at CFM. In other examples with PSL, with a lot of fluid content with septum and hyperechoic point inclusions like gas. In other examples of orthoepididymitis with hypoechoic area with increased blood flow at CFM, in some planes it looks like layer cake, heterogeneous structure. Another example of acute scrotum. This is edema of the scrotum of unknown origin. A child of 1 year. We can see the absolutely normal testicle and only thickened scrotal wall with increased blood flow at cauliflower mouth. And this is condition after testicular torsion. This is teenager which came to the public clinic for scheduled medical examination, and on initial scan I suppose that this can be an orthoepididymitis, but there is no pain, there is no complaints. So a little later I get the information that in this case was torsion before of testicle, and so we can say that the hypoechoic, anechoic areas in the testicle is infarcted area, necrotic area after the ischemic testicular changes after torsion. Thank you. That's all.